November is not just about Thanksgiving. It is also about lung cancer awareness. I met with Casey Harvell, the Massachusetts Director of Public Policy for the American Lung Association, to find out what you need to know about the disease.
The symptoms of lung cancer can be a little tricky because some people experience no symptoms, some people get tired really easy and they know that's just not them. So we really just ask people to be aware of their body, and especially if they know that they are at high risk for lung cancer, that they make sure they speak with their doctor. Three of the big risk factors would of course be if you smoked, if you've been around a lot of secondhand smoke, if you've been exposed to radon, and it's actually a higher risk if you've been exposed to radon and are a smoker, and then also air pollution. The people that are eligible for screening are between the ages of 55 and 80. They have a history of smoking within the past 15 years, and they have a history of basically 30 pack years. So pack years can be a little tricky. It basically means that you smoked a pack a day for 30 years, or you could have smoked 2 packs a day for 15 years. So it's one of those things, the heavier you smoke, the shorter amount of time would be eligible for screening. And if you are eligible, that is covered by insurance, and your local health center should be able to at least point you to someone who can do that, and you would get tested every year until you reach the age of 80. We're very active on the policy level. We work on controlling tobacco, trying to raise the age is a current big initiative for the Lung Association. We also work on encouraging people to test their homes for radon, especially if they're new to the home. We also work on limiting sources of pollution, whether it be through promoting solar energy or promoting the transition to zero-emission vehicles. And so we've done a lot of different work, and we also have Lung Force, which is our signature initiative, which is addressing specifically women and lung cancer, but the general population and lung cancer as well. In the past 30 years, we've really seen a huge increase in women in lung cancer, while men in lung cancer has actually decreased slightly. So we really want to make sure that people are aware that lung cancer is a major health issue. We're trying to remove some of the stigma. In the past, it's always just been, have you smoked? And that's really a question we're trying to get away from, because anyone who has lungs can in fact get lung cancer. We have a lung helpline, which is 1-800-LUNG-USA, but there are also resources in your local community, and at the state level there's quit programs, and so we would encourage you to take that step and also distance yourself from secondhand smoke whenever possible. We're really just trying to raise awareness. We had a recent survey where most people still don't see lung cancer as a concern of theirs, and I think given that November is lung cancer awareness and that it's not just smoking that leads to lung cancer, that everyone could be at risk, that we really just want to make sure people are aware of the different risk factors and that they do the best that they can to protect their lungs.